How do CSF, protein, and glucose levels indicate leukemia? Imagine a tiny fluid test that can reveal hidden signs of leukemia affecting the brain and spinal cord. That test is part of a procedure called a lumbar puncture, where a doctor collects cerebrospinal fluid, or CSF, to look for clues about the disease spreading into the central nervous system. When leukemia involves the meninges or brain, the CSF can show changes in protein and glucose levels that help doctors understand what's happening inside. Normally, CSF has very low protein levels because the blood-brain barrier acts like a filter, keeping large molecules out. But if leukemia cells invade the meninges, this barrier can become more permeable. As a result, more proteins leak into the CSF, causing the protein levels to rise. Sometimes, the leukemic or inflammatory cells in the CSF can even produce proteins locally, further increasing the levels. While high CSF protein isn't exclusive to leukemia and can also occur with infections or other tumors, in the context of leukemia, it suggests that the disease has spread to the central nervous system. When it comes to glucose, the CSF normally has about 2/3 of the blood glucose level. This balance can be affected if leukemia cells infiltrate the meninges or if inflammation occurs. Leukemic cells and associated inflammation tend to consume glucose or interfere with its transport into the CSF, leading to lower glucose levels, a condition called hypoglycemia. But low CSF glucose isn't unique to leukemia. It also appears in bacterial or fungal meningitis. So, while decreased glucose raises suspicion of CNS involvement, it isn't definitive on its own. To confirm leukemia's spread into the central nervous system, doctors look for actual leukemia cells in the CSF. This is done through microscopic examination called cytology or flow cytometry, which can detect malignant cells directly. Elevated cell counts, especially lymphocytes, combined with abnormal protein and glucose levels, increase the likelihood of CNS leukemia. However, these CSF findings alone can't distinguish leukemia from other neurological conditions because many issues can cause similar changes. In practice, analyzing CSF during a lumbar puncture is crucial for staging and planning treatment. If leukemia cells are found along with abnormal protein and glucose levels, it indicates CNS involvement, which may require targeted therapy to prevent neurological complications. Monitoring these parameters over time helps assess how well treatment is working and whether the disease is returning. In summary, elevated CSF protein and decreased glucose levels can be signs that leukemia has spread into the central nervous system. These changes reflected damage to the blood-brain barrier and the activity of leukemic cells within the CSF. When combined with direct detection of leukemia cells, these findings help doctors diagnose, stage, and manage leukemia involving the brain and spinal cord. Always remember, if you or someone you know is undergoing testing for leukemia, consulting a healthcare professional is essential for personalized advice and care.